Looking at Elizabeth's x-rays, she's got flattening of the humeral head. She's got superior migration of the humeral head beneath the acromion. Her glenohumeral joint on the axillary view looks narrow, so she has at least moderate arthritis. The superior migration of the humeral head beneath the acromion basically means that you're missing part of the rotator cuff, because the rotator cuff would keep the head depressed within the joint. And when you have a large or massive tear of the rotator cuff, then the humeral head can buttonhole through that tear and sit underneath the acromion. Well, looking at her MRI, she has a 3 centimeter tear of her supraspinatus, and we sort of judge, tears less than 3% is usually repairable. When they get to be 3 centimeters from the greater tuberosity, we call those large, and they're a little iffy. When they're 5 centimeters or larger, they're near the glenohumeral joint. That means the tendon is retracted to the socket of the joint. Then it's really questionable whether those are repairable or not. She does have some loose fragments of bone in her joint from either calcifications or from arthritis. She's got an inferior bone spur. So the big question is treatment for that, because she's got a rotator cuff tear and arthritis. She doesn't have severe, what we call rotator cuff arthropathy or cuff arthropathy, but she does have fairly advanced arthritis, but she doesn't seem to have that much pain, and she's got good range of motion. So I don't think at this point she's a candidate or needs a shoulder replacement.
Yay.
If she did have a shoulder replacement, we most likely would elect to do a reverse total shoulder, because you can't do an anatomic total shoulder with cuff tears. So if we're saying we're going to delay any prosthetic repair, would she benefit from an attempted rotator cuff repair? With 3 centimeters of retraction at her age, the question is, would she heal, and would that help her? When I say when she heals, the first thing is we have to be able to grab the cuff, release all the adhesions, and advance it down 3 centimeters, which is a fair amount, and then we sew it to bone. But sometimes the rotator cuff doesn't always heal. That would be one possibility. That would maybe potentially give her some strength back if it healed, and maybe depress the humeral head a little bit. But she's still going to be left with pain from the arthritis. So that's one of her options. I think she's doing too well. She can get her hand overhead. She doesn't have that much pain. So I'm pretty conservative. I wouldn't recommend reverse total shoulder at this point in time. So the question for her is, does she just want to manage this with an occasional cortisone shot, which will relieve some pain? Or does she want to attempt the rotator cuff repair, knowing that that's only going to potentially give her some strength, maybe some pain relief, but she's still going to have residual pain from the arthritis within the glenohumeral joint. So that's sort of 3 options. Cortisone shot just to maintain pain relief, but not improve function, not change any arthritis. Attempted rotator cuff tear, which potentially could relieve some pain by depressing her humeral head, potentially give her a little bit of strength, but may not be successful at her age and with that big of a tear. Or third option is wait until her pain is worse and then replace her joint. That's it in a nutshell. Uh-oh. I didn't think I was going to be part of this deal.
Thank you, doctor.
Crack your camera.